Hi, here we'll talk about whiplash injuries. First, there is a state of acute hyperflexion. So what is hyperflexion? The head will be bending forward, then it hits an obstruction present in front of it, which causes this hyperextension. So this rapid movement of this flexion and hyperextension causes the neck injury, which is called as whiplash injuries. So it is seen in rear end or the side end collisions of the vehicle. Now let us read the whole thing. It is a violent acceleration-deceleration force applied to the passenger, usually seen in rear end collisions or the side impact collisions, and the passenger is usually present in the front seat in the motor vehicle, right? So what happens when the vehicle stops suddenly? There will be acute hyperflexion state where the head moves forward and hits the obstruction present in front of the passenger, can be windshield or anything, leads to reactionary hyperextension. So the head is thrown back. So it causes whiplash injury. And there can also be another scenario where there is first hyperextension and which is followed by hyperflexion. So when the first vehicle hits the second vehicle from behind, which causes first hyperextension, then followed by hyperflexion. So it is also a type of whiplash injury. So this violent extension and the flexion movement causes the injury, which is called as whiplash injuries, right? It can be seen in rear end collisions, side impact collisions, blow on the chin and the rabbit punch. See, a sharp blow against the spinous process of upper cervical vertebra leads to fatal contusions without any fracture. So the signs and symptoms of this whiplash injuries can be categorized under three categories. First is spinal cord injuries, second is soft tissue injuries, and third is fractures or dislocations. Coming to the spinal cord injury, there can be spinal shock, right? And also there can be spinal cord injury along with the brain injury, which leads to concentration and the memory problems, blurring of vision, tinnitus, vertigo, headache, dizziness. Coming to the soft tissue injury, there can be injury to the muscles of the neck, which causes pain and stiffness, and lacerations or the contusions of this tendons or joint capsules, intra-articular hemorrhages. So these are the different things which can be seen under soft tissue injury. There can be pain, stiffness, lacerations of the muscle tendons, joint capsules, intra-articular hemorrhage. Coming to the last one, which is fractures or dislocations. So cervical vertebrae C4 to C6 are more prone for this fractures. So at the C4, spinal respiratory system is present. So if there is any injury to the C4, it also causes irritability, nausea, fatigue, numbness, difficulty in swallowing, and all the other symptoms. And also if there is any injury above C4, it causes quadriplegia. If there is any injury at the level of T1 or T2, it causes paraplegia. Or you can also see this fractures of cervical vertebrae, atlanto-occipital dislocations. So to summarize the whole thing, spinal cord injury causes spinal shock, and also brain injury along with the spinal cord causes this blurring vision, tinnitus, vertigo, concentration and the memory issues, right? Coming to the soft tissue, it causes pain, stiffness along with lacerations of the tendons, joint capsules, intra-articular hemorrhage. Coming to the fractures, the most commonly prone area is C4 to C6. So any injury at the level of C4, it also affects the spinal respiratory system, which causes nausea, fatigue, numbness, difficulty in the swallowing, and other symptoms. And if there is injury above C4, it causes quadriplegia. If the injury at the level of T1 or T2, it causes paraplegia. There can also be fractures of cervical vertebrae, atlanto-occipital dislocations. The different signs and symptoms seen in whiplash injuries. So what do you diagnose it? You can take X-ray, you can do MRI, and also you can take the CT scan. MRI is done for soft tissue especially. So X-ray, you can see the bones, right? Now coming to the medical legal importance, you can refund this claim based on the whiplash injury from this car company or the motor vehicle company. So refunding claims based on the whiplash injury is the medical legal importance. So this is about whiplash injury. Bye.